That's it. Good. Loose. Good. You're gonna feel smooth, and it's focused. Hey everybody, it's Dr. Warren here at Kalkstein Chiropractic. This is Denise, and she's amazing, and she's here working with us. Denise, I'll let you kind of fill in about your history of coming in and your experience, but I'm gonna talk real briefly about what I'm about to do. I'm doing some soft tissue work on her lat and her rector spinae group and her low back. Soft tissue work, it's a pin and stretch style of soft tissue work, so there's a lot of active movement from her, and you'll see that as she's going through these passes. And then I'll show you how I adjust her really gently with a lot of compression, a lot of just gentle pressures, and then how I work on her hip very, very lightly. And then I'll work it a little bit more and a little bit more and a little bit more of a deep tissue massage on the hip that she responds really well to. She is the mother of a chiropractor.
So originally I came here because my son recommended me to come and get dry needling.
Dry needling was the first recommendation?
Yes.
So he looked, because that's right, he was looking at our practice. He actually
was looking at the practice to be employed here. He was trying to figure out where he was going to land as a chiropractor. As it turns out, he landed in Charleston, South Carolina.
Where is he in Charleston, South Carolina?
In Charleston.
Where in Charleston? Is he in the county?
West Ashley is
West
the
Ashley?
actually little part.
What's his name?
Jesse.
Dr. Jesse Persigan. Dr. Jesse Persigan.
Actually, his practice is
if
not.
If he fell anywhere off the tree from her at all, I'd go see him. And then, so what do you do for a living?
I'm a registered nurse. I work in a NICU.
And so, what do you do in that NICU? You're in charge of that NICU with another nurse, correct?
No, actually, we are the lactation consultants in the unit.
Okay, sorry about that.
So, we are bedside nurses who also happen to be lactation consultants.
Gotcha. And how long have you been working at that hospital?
35 years in the same unit.
Really?
Yes.
You're amazing. So what happened when you first came in? You were told to get dry needling because you were hurting?
Well, that actually was for my back, because my upper back, nothing is ergonomically correct where I work because it's an old unit. So I fell, and that started my hip. So I was treated for a little while for my hip, and then, as anybody, I was not compliant. And I kept running until one day I couldn't walk. And that's how I came back in here. And now I'm back running and doing all of my exercising. And what he's doing now is phenomenal. Because this really loosens me up.
Reach your right arm up. Good. Good. Now bend. Good. And Liam, you can come from. Is it okay if I show me working on your skin?
Yes.
Thank you. So, from this position, I come in and my thumb is going up her back, and I'm working on these back muscles here, but I'm getting into the lat and following it up through behind the shoulder blade. So I start here, I shorten her, I lengthen that tissue, and then I follow my hand up. I lift with both arms, and I'm lifting her torso up, and I'm following that lat muscle all the way to the shoulder blade and back down. So I loosened it up, and now she's a little bit more relaxed. I can really get deeper into that tissue. Good. Good. Now I'm going to work into the glute med. Go ahead and reach. Good. And go. Good. And come back. A little more pressure on the ilium here. Go ahead. Right there. Good. Alright, and relax. Come on to your side here for me.
What's my left side?
So I combine that soft tissue work from time to time, depending on the problem, depending on the severity, right? And so she's really, really active. She works out with an awesome trainer, Joe
Dressler. Merritt and Canton.
Merritt and Canton. And Jen down there is amazing too.
Yes.
There's another guy, I can't remember his name off the top of my head. I apologize to him if he watches these.
It's going to come to me.
buzzed head, bald head,
I know
completely
what
shaved.
it is. Jason? No. I can see him in my head.
We're going to do a video, just a shout out just for him, because I feel so bad, because he's an awesome trainer too. Those 3 trainers, but Joe Dressler, he's kind of been down there for a while, and he's awesome. Great, like amazing human being, and an amazing trainer. So you can't ask for better of a situation when you're working with someone towards getting healthy. So if you're in Baltimore City and you're looking for an athletic trainer, go check out Joe.
The staff here is great. From when you walk in the front door, everybody knows who you are. The staff back here, the chiropractic assistants, they are very helpful in exercising, stim. I'm getting everything prepared for, I'm still getting dry needling, and the chiropractors, excellent at dry needling. They hit the spot. And then what you just saw in the video with what Warren does with the tissue manipulation, that has helped me tremendously to be able to get back to not only just being able to walk, but back to the level of exercise that I like to do. My son is a chiropractor, so obviously I buy into chiropractic. I think that you would do yourself a disservice if you wouldn't come to a chiropractor. You'd be very surprised at how it would benefit you. This office, I love. This is the third chiropractic office I've been to in the Baltimore region, and this by far meets all of my needs, from the expertise of the actual clinical work, how they know me as an individual. It meets all of my needs. If you're able to let yourself meditate through it, you will benefit greatly by it. Yeah,
and to be honest with you, I don't do that on people that don't even that open that window for me, right? I wouldn't even bother, because they'd fight me too much. Come back towards me and sit up nice and tall. Good. So she's fixated right here at T8. I'm going to bring her into extension back on me. I'm going to rotate her a little bit to scoop that rib into the right place. So it's smooth and it's focused. Good. And then you're going to go onto your side right here, facing this way. I adjust the thoracic spine first because I find I get better release in the lower back if she's moving better in the mid back. So when I get her into this position, I need her to be able to rotate through her thoracic spine like that. And if she's locked up here and she's guarding, she won't move as well. So if I can, if it's appropriate, I'll move the mid back first. Breathe in for me. Easy, exhale, loose. Good, breathe in, loose. Smooth, easy, exhale. Good. Breathe in. Good, I'm going to stretch you now. Exhale, loose. That's it. Alright, now relax that shoulder. You're just going to feel a quicker drop from me. I'll do a little distraction here so you stay nice and relaxed. That's it. Good. Good. So her SI joint, some people just set them up and right? Some people are a little bit more tense in that area, just the way that they move, and from a lumbar and an SI joint perspective, they don't adjust as easy. She's one of those cases, so I have to be a lot faster, and there's a lot of distractions that I'm doing when I adjust her, because it kind of took me a little while to figure her out that way. Breathe in for me. Easy, exhale. But you gotta build rapport with people. You gotta build trust. It's not like you don't run into these things, right? You gotta take your time, build a relationship with someone, and that's how you get a valuable relationship. You build trust, understanding, and then you've got hopefully a healthcare practitioner for not just a few visits, but for a long time. All right, a little bit of distraction here in the hip, loose. Good. You're gonna feel a little bit more. So for her, I have to get that hip in the right angle for her to get that release. There we go. That was it.
I felt it.
So you can feel a little distraction here, okay? Good. Now what I want you to go is on your stomach. I'm going to adjust your knee today, okay, Denise?
Other than my son, he's the only person that is able to get my body to move the way he's getting it to move. So
I could. That's awesome. Thank you for that. I'm excited to get adjusted by your son one day. We'll do a video. I'm serious. So this technique is taught by Mark Charette, but it's really effective for just taking care of some of the tension. If there's a little bit of laxity from side to side in the knee and the way that's moving that's not there in this knee, and I want to address that. Right? She doesn't go into end range extension well in this knee. She has a lot of tension and rotation, so you'll feel a lot of pressure here. Okay. Firm pressure. Good. A little bit more. There it is. Good. Good. Sometimes I forget. She doesn't like the table being right enough. But I can see that leg kick off like, oh, no. You alright?
I didn't want to videotape it. Alright, which way you want to go?
You're all set.
Oh, thank you, sir.
You're welcome. Yeah, no worries.